we've got a clinical case, my beloveds. A 35-year-old lady presents with complaints of heavy menstrual bleeding, pelvic pressure, and increased urinary frequency for the past 6 months. She denies any fever or vaginal discharge. Okay. On pelvic examination, the uterus enlarged, firm, and irregularly shaped. Which of the following is the most likely diagnosis? Give me options. Adenomyosis, endometrial carcinoma, no, uterine fibroids, leiomyoma, endometriosis. That's the correct option. So let's clinical case recap. We have 35-year-old woman, heavy menstrual bleeding, so-called menorrhagia, pelvic pressure, urinary frequency, enlarged, firm, irregular uterus. Correct option is obvious. Uterine fibroids, leiomyoma. Now let's break down why the other options are incorrect. Adenomyosis, key clue. Adenomyosis causes diffuse, uniform enlargement of the uterus, not irregular. So the uterus feels soft and tender, more soft and tender, not firm and nodular, yes, in this case. Pain, dysmenorrhea, is usually more prominent than the pressure symptoms, often seen in multifarious women aged 40-50 years and history of abortions. Histologically, endometrial glands invaded the myometrium different from fibroids, which are smooth muscle tumors. So in short, adenomyosis, uniformly enlarged, tender uterus, fibroids, our case, irregular, firm, bow-slated uterus. Next, carcinoma, endometrial carcinoma, typically affects postmenopausal women. Main symptom, postmenopausal bleeding, not menorrhagia in a young woman. Uterus is usually not markedly enlarged or irregular, and may be associated with obesity, diabetes, and opposed estrogen therapy. And unopposed estrogen therapy, yeah. Yes, of course, unopposed estrogen therapy. In short, endometrial carcinoma, abnormal postmenopausal bleeding, not pressure, symptoms. Endometriosis. It usually presents with severe dysmenorrhagia, chronic pelvic pain, and infertility, not heavy bleeding, with uterine enlargement. Then, the uterus is often normal in size or fixed due to adhesions, not enlarged or nodular. Lesions are ectopic endometrial tissue outside the uterus, on ovaries, ligaments, or peritoneum. So in short, endometriosis, pain and infertility, not enlarged, irregular uterus. Actually, infertility also we can see in a myoma. But anyway, endometriosis, we have a pain and infertility, not enlarged, irregular uterus. Finally, that's all. So uterine fibroids, leiomyoma is correct. Why? Most common benign tumors of the uterus. Symptoms that we've got, menorrhagia, pressure symptoms on bladder or rectum, no, here on bladder, and infertility. Yes, exam findings, firm, irregularly enlarged uterus. Pathology, clonal proliferation of smooth muscle cells, estrogen and progesterone dependent. So what to do in this case? First, we do not start, if it's a not urgent case, what we have to do? Restoring overall health through proper hydration, number one. We prescribe proper hydration, don't take knife immediately. Proper hydration, limiting refined carbohydrates, regular physical activities, sexual well-being, and maintaining sexual well-being, and quitting harmful habits like smoking. And in 6 months you will see a magic. That's all. Stay blessed.